Okay, so we're here today talking to my dear friend and my personal doctor, Dr. Gabrielle Francis. She is a naturopath. She does acupuncture, chiropractic, holistic medicine. She's been practicing for 35 years. She is located downtown in Soho in New York City. She's the author of the Rockstar Remedy, and she has a special focus in her practice on pregnancy and fertility, which is why we wanted to talk to you today. Hi, Dr. G.
Hi, Candace.
Thank you so much for being here. And one of the biggest reasons that I wanted to have you on here is because you helped me so much throughout my pregnancy and postpartum. So today we wanted to talk with you about what's being called the fourth trimester. So after moms have had the baby, there's more highlighting of the fact that we go to so many appointments as we're pregnant, but then after the baby comes out, we go to one appointment. And so putting a focus on how we care for ourselves as new moms in a wide range of ways.
Well, you were the one that taught me about that. I never heard of the fourth trimester, and I love that there's a new consciousness around it, actually, because it's such an important thing to bring forward as women are really focused on how they take care of themselves in their pregnancy, and they're going through this massive life transition. They have the baby, and then all of a sudden they're a new mom and the focus is just on the baby and not on them anymore. And so to bring that awareness, I think, is very important for the health, because you're going through physical changes, relationship changes, career changes, hormonal changes, and your whole life is completely different. It's like there was a death and rebirth almost. And so to bring that awareness, I think, is just amazing. I'm glad that there's this new movement about it.
Absolutely. And I think some of the things we're going to talk about are what we would call the pillars of that, right? So you touched on it a little bit. There's all these different pieces of a puzzle to being a new mom and taking good care of yourself. And I think the reason sometimes it gets overlooked is because we as moms are so giving. So we give and we give and we give. And at a certain point, you have to realize that as healthy as you are as the mom is the amount of health that will be in your family. So you really are at the center of the family.
Now, one thing to think about too is I'm not sure if the audience is just the new moms, but for anybody who is actually pregnant now, this is the time you want to start thinking about this, because you have a little bit more time before the new child comes to start prepping your life and your body for the fourth trimester. Do you know what I mean? So I think that this content that we're going to talk about and the conversation is very important for women to start thinking about in advance. Now, a lot of women already have had the children, but it's something to think about for your next child as well.
Yep. So I guess the first thing we want to talk about is a health check, right? You call it a health check. So it's kind of figuring out your baseline. Is that a good way of putting it, where you are?
Yeah, so you just had a baby, and for 9 months, little Junior was charging off your batteries, and you just had a baby, and now the batteries are depleted. So all the focus post-birth is on the baby, and there's not enough focus on the new mother. And in my practice, I usually in the third trimester, before the baby comes, I give them a blood work handout so that within the first month or two post-birth, the sooner they can do it than later, I have them do a full blood workup, checking their blood levels, their iron levels, their vitamin levels, checking hormones, and in particular the thyroid and the adrenals, because the thyroid and the adrenals are the gas tank and the battery. And while you're pregnant, the baby's charging off of your battery. So there's two people living off the same battery and gas tank. So I like to look early on in the new motherhood as where the mother's body is at that point. And so that we can really build her up and replenish her reserves so that she can really have all of the reserves she needs for being a new mother, to enjoy it and to be healthy. Because a lot of what we see as depression and anxiety and postpartum type things are really related to physical depletion. And, she's going to need those reserves to be able to deal with things. So I like to have women consider having a doctor or a partner or even their general practitioner or their OBGYN do a general health checkup on them to make sure that they're in good shape for this new phase.
So now, question on the blood work, getting that ordered through your OB or whatever your situation is, who you're dealing with, there is a way that it would be covered, right? Through all insurance.
It would be covered by insurance, yes, as long as the doctors coded it properly. And if you want, I can put together a handout or a PDF download for you that would be the kind of tests that I usually recommend for my patients, that the women watching this show can ask their doctors to do for them.
Amazing. What an incredible resource.
I take that information, and based on that is how I put together the rebuilding plan for her.
Okay, great.
Okay.
And I know when I was pregnant, I went through a lot of changes, and like any mom does. But I think one of the things about pregnancy is it's such a different journey for every mom. So it's hard to kind of like streamline a one-size-fits-all approach to it. But I found for me, one of the things that I didn't even realize was that 50% or something like that of pregnant moms actually experience some level of depression while they're pregnant. So it's not actually something that only happens postpartum. Your hormones can just go totally nuts at any point, really, right?
Yes. The kind of depression during pregnancy and is usually related to kind of just the huge levels of hormones surging through their body and how their body is processing those. And even though progesterone is the pregnancy fertility hormone, it's holding that baby in there. It helps mood in some way because it helps anxiety and depression on some level. But for some women, the very high levels make them feel very heavy and down. Also, because the baby is charging off your adrenal and your thyroid, if those organ systems are depleted before you even go into the pregnancy, depletion of those hormones can also add to depression, fatigue, anxiety, and some of those are just the general thyroid hormones. But the adrenal hormones are things like dopamine, serotonin, adrenaline. And so it's depletion of that because you and the baby are taking from the same source. So why does a woman's adrenal and thyroid get depleted? Well, because we go, and we don't recharge. So if you continue to go, you're using up your body's reserves. And when they get depleted, you can have deficiencies in these hormones. And another reason for the depression that can happen in the third trimester and even in a new mom is that, there's a certain archetypal death and rebirth from being a free, independent person to now being a new mother. That's a huge shift. And you lose a certain amount of independence, for the rest of your life. You have this very intense responsibility, which most people are honored to have. A lot of people have had a hard time getting pregnant. They finally have this gift of a new baby. But it is a very real thing that there's a certain freedom that's lost. And I think a lot of people go through a grief about that.
Yeah, so true. And I think it's one thing to just kind of try to push the problem away and say, oh, I'm just tired, I'm pregnant, or I'm just tired, I'm a new mom. And to say, okay, I can actually do something about this. I think that's really empowering, because once you get more of the serotonin and the good stuff going, motherhood can be, much, much better. If it was tough, it can be a little bit easier if you're feeling better. And if it was good already, it can be great, right? That's what I felt.
One of the best metaphors I could use is that you know, the general health is the body of the car, but the adrenal and the thyroid are the gas tank and the battery. So the body of the car can be perfect, but if there's no gas in the tank, there's no charge in the battery. You look good and you can do the local errands, but the cross country trip is going to be a stretch. And being a new mom, it's a cross country trip. And what about being a new mom of two babies? Can you please tell us what that's like?
Thing is multiple.
Double the work, double the stress.
Yeah, I think double the hormones. So for all the moms who have multiples, you really can get just extra of anything. So I definitely felt all of the extra hormones, all the good stuff after, but I definitely felt a lot of the tough stuff. Being pregnant was really hard. I mean, it's hard for everyone.
It might be good to talk about what happens in the body after the birth. So, you know, while you're pregnant, your body's surging with estrogen and progesterone, and you have the baby, and those hormones plummet. If the baby passes through the vaginal canal, you have a large surge of oxytocin. Oxytocin is a narcotic, it's our bonding hormone. And when a woman breastfeeds, she also has a lot of oxytocin. So oxytocin gives us a sense of well-being, connection, almost a euphoric type quality. So it's kind of like all those hormones drop, the rug gets pulled out from underneath you. But the magic carpet is the oxytocin, it kicks in. And women will notice, especially if they're breastfeeding, that there is this type of euphoric type quality to that interaction. And there's actually a hormone happening, and that is oxytocin. It is like a narcotic, okay? So if women weren't able to have a vaginal birth, and if they're not able to breastfeed, that oxytocin isn't there for them. They often will experience a little bit of that blues quality immediately after the birth. And sometimes that's what's happening. It's not always, but that can be what's happening. For women who have the baby and they breastfeed and then they stop breastfeeding a few months later, when that oxytocin starts to wane and they stop breastfeeding and there's no oxytocin, that's for a lot of women when they'll get that kind of blues, sad quality. It's not necessarily postpartum, but there will be a little bit of a shift like that. And that's just kind of the hormonal component of it. It's also very common for women post-birth to be hypothyroid, and they'll lose hair, they'll have extra weight that they can't lose. So that's one of the most important hormones that they need to get checked is the thyroid. And that's a very easy one for everybody's medical doctor to check.
Okay, this is amazing. I feel like not nearly enough people talk about hormones, and it's one of the reasons I love you is because you're so knowledgeable at it, and it's so important, and we just don't talk about it enough. But as women, our hormones can really dictate a lot. I mean, men too, but certainly going through pregnancy and all of that, it's definitely one of these, right? It can really put you through the ringer.
And another important thing to know is that estrogen and progesterone are your mothering hormones, okay? So when women are under the age of 40, their estrogen and progesterone is very high. And those hormones literally wire you to give, and get nothing back. To have your identity be based on who you take care of, who you love, and who needs you. Okay, so those hormones wire you for motherhood. And even women who don't have children, when they're in their pre-menopausal time, that area before the age of 40, those high levels of hormone make us givers, mothers, creatives. It just nurtures us to be that kind of person.
Yes. Okay.
Have a doctor or a health partner that can help you navigate some of this, because some people may not have the resources to have a naturopath or somebody in their area, but there are other types of health practitioners, even the OBGYN or their general practitioners, that can help them navigate some of these post-birth hormonal changes.
Okay, so next thing that we wanted to talk about, almost equally as important as the hormones, are your nutrition and diet. And so this is something that I struggled with as a new mom. I think in general in life, I've struggled with my diet like a lot of people, but as a new mom, I had to really see food as fuel. And I feel like you were one of the key people to really explain to me, as a breastfeeding mom or a non-breastfeeding mom, but they're probably a little bit different. How do you take the best care of your nutrition and health to feel your best, so you can be the best version of yourself?
Okay, so you want to really think about that post-birth, we're in a phase of where we really need to build our bodies back up. And whether you breastfeed or not, protein and fat are the building blocks. Carbs give us the energy. And it's very common post-birth, just because women don't have a lot of time and they're overwhelmed, that they go more for easy things that are carby. And the more carbs that you have, the more difficult it's going to be to kind of lose the weight. Also to feel satisfied. Okay, so you always want to make sure that you're eating protein and fat with complex carbohydrates on top of that. Even more importantly, if you're breastfeeding. So what the baby wants from the breast milk is protein and fat, because the baby is in an extremely large time of building its immunity and building its nervous system. So what the baby's trying to get from the breast milk is protein and fat. And the more protein and fat that the baby gets from the breast milk, the more satisfied it is, the more balanced its blood sugar is, and the less often they have to feed. And then that helps the mother to regenerate. So protein and fat foods are things like meat, chicken, fish, and with the meat, you want it to be organic, clean meats if possible, or grass-fed, organic eggs, organic cheese and yogurt, nuts and seeds, beans and legumes. Vegetarian proteins would be things like quinoa, oats, beans, nuts. Eating things like olive oil, coconut oil, avocados. So you really want to have a lot of protein and fat foods that you eat maybe 4 times throughout the day. And then include on top of that fresh fruit, whole grains, and carbs. But if you're just eating carbs only, you're going to feel like a constant eating machine. You're never satisfied. The baby's never satisfied. It's got to constantly eat.
That's great.
And, one thing I'll recommend is that a woman engages her husband to help her, or does this herself, like once a week, preps herself with little snacks. So makes a bunch of hard-boiled eggs, gets some yogurt with some muesli or granola, has cottage cheese, has hummus and some cut veggies for dipping, and just has nuts and seeds, things that are ready there, easy to grab, that take no preparation, so that you're never really hungry. Another thing you can do is make a smoothie, a breastfeeding smoothie. And I usually recommend people use whey protein, because whey helps to build antibodies, the antibodies that you're going to pass on when you breastfeed. If you don't want to do whey protein, you can use either goat or sheep yogurt in the smoothie, because goat and sheep milk is almost identical to human milk. So it helps to build up the antibodies that we're going to be passing on to the baby. And the yogurt also has probiotic in it. So you could put probiotic in there. I always recommend that people put some kind of flax oil or organic, like fish oil, for the omega-3s, because the omega-3s are very important. A tablespoon of omega-3 in the smoothie. And then if you have access to any of those superfood green food powders, you can add that into the shake as well. And you can mix up the smoothies at night, because women typically don't have a lot of time in the morning to take care of themselves when they have a new baby. So I usually recommend that they make their shakes at night, maybe make 2 or 3 days at a time, keep it in the refrigerator, wake up, and then sip on that throughout the day or the morning while you're taking care of the baby. But then you're like really nourishing yourself with something extra. Something extra.
Now, I know that you are so knowledgeable in supplements also. So when you're talking about postpartum and being able to recharge the battery of the car, obviously every person's different, but for most moms, what do you recommend postpartum?
I recommend for anybody breastfeeding that they should stay on the prenatal. There's some brands that actually offer a postnatal vitamin. I also recommend that you get food-based prenatal postnatals to use, brands like New Chapter and Rainbow Light. And the prenatal postnatals, if they're food-based, are going to recommend anywhere between 3 and 6 pills per day, because if it only is a 1 a day, it's got the vitamins, but it has very little minerals. The minerals can be listed on there, but they're not significant. It's what we call cosmetic labeling, okay? So a real food-based prenatal postnatal is going to recommend between 3 and 6 pills a day to get all your nutrients. I usually recommend that women also supplement with a tablespoon of either fish or flax oil to get your omega-3s. I recommend extra calcium and magnesium that you take at night because you're going to need that to pass on to the baby. And I recommend probiotics for everybody as well. And then regarding specific things like B vitamins, iron, vitamin D, those are really things that are based on what we see in labs. If we are seeing deficiencies and stuff, they might need extra iron. If we see a vitamin D deficiency, definitely they need to be taking vitamin D.
In terms of getting into like your body and your fitness, I know a lot of new moms feel totally, I don't know if detached is the right word, but it's sort of like an out of body experience, and you feel very I don't know, removed from your old self, kind of like you were talking about. There's a rebirth, and I definitely had that for myself, where I felt I was a new person and I had let go of everything I used to be, and now I was this mom to these amazing babies, and that's my identity and all of that. But at a certain point, physically, pregnancy just puts your body through the ringer, and you have to be able to move and stretch and feel and all of that. So can you talk to us a little bit about what, just the immense toll that pregnancy can take on your body, and how do you sort of start to rebuild the pieces?
Yeah, I mean, there's, it's like being abducted by an alien, and they've been living for beautiful little aliens been living off of you. They come out, they're all happy, and you're like, what the hell just happened to me? That's why it's really important to build up. But one thing that's important to bring up is that while you were pregnant, your body was secreting a hormone called relaxin. And relaxin literally weakens your ligaments so that your pelvis can get wider, but it weakens all the ligaments in your body. And that's why women feel very wobbly. They walk differently. They can often get neck and back pain while they're pregnancy. So you have this weakening of the ligaments. The muscles tighten up to try to compensate for that. And your body has, more aches and pains. Plus you have the extra added weight to it, which gets progressively more as you have a baby. So after the birth, usually between 8 and 12 weeks post-birth, the relaxin starts to reabsorb and everything tightens up again, okay? So this is an important time for a woman to go in and see her chiropractor and get an alignment, especially if she had issues with neck and back and feeling out of her body during the pregnancy, because you want to make sure that everything's lined up before all those, before the relaxin reabsorbs and everything tightens up again. I do a treatment called the Mayan abdominal massage. And the Mayan abdominal massage is something I learned in Central America from the Mayan midwives. And it's a massage that is from the outside, but we literally realign the uterus and the ovaries. And that also is an important thing if somebody has access to that. And I'll tell you how you can find a Mayan practitioner in your area. Um, if somebody has access to that, usually between 8 and 12 weeks post birth, I recommend people have that uterine alignment because that will change if their cycles come back to normal. It'll make it easier for the second baby, and it'll take a lot of that heaviness and frumpiness out of the belly and the pelvis. It's very important to keep moving after you've had a baby, even though it might not feel good to you. Even just gentle walking and getting the babies out and walking with them and keeping your body circulating. And you don't have to overdo it. There's so many online programs now where people don't actually have to go to classes to be able to do either a little gentle yoga or a 20-minute aerobics fitness class in between when the baby's sleeping. You have to really put yourself as a priority. Self-care is not an indulgence, it's a necessity. And it helps make you feel so much better about yourself, And try to think about once a day giving yourself a luxurious shower, getting, prepped up, and just like you are going to go out in the world for yourself, not just so that you can get out of that feeling of frumpiness. Nobody wants to feel like that. It doesn't make us feel beautiful anymore. I hear this from so many mothers.
I was going to say the shower, the daily shower became a very important part of my days right away after being postpartum and coming home from the hospital. It was like just a moment of quiet, by yourself, clean up, feel good. So much of what you're doing immediately after having the baby is you are this machine, whether you're breastfeeding or not, but if you're breastfeeding, you're definitely a milk machine for your baby. And so it's not dissimilar from your analogy this whole time about being the car, but it's like taking a second to do, just maintenance, just clean up, feel good, relax, take a deep breath, have a moment alone. I think for me, that was really important just to get
the help, right?
Yeah, because at a certain point, I just would say, okay, I'm going to take a shower. And I would just leave the room once a day. And he had to figure it out. And they do figure it out. But you need, even for me, it was about just having a moment by myself. I felt like I was constantly around other people, pulling and prodding and giving. And it was like, okay, I get, 20 minutes to just be alone.
Yes, and just giving yourself beautiful shower gels to use and coming out of the shower and putting luxurious body oils and treating yourself like the new queen that you are, giving yourself that time and then letting the husband or the partner have that time with the children helps them to create some bonding because after the birth, the babies really just want the mother. And so the husbands often feel a little isolated anyway. So it's a good way to help them kind of get engaged as well.
And I just learned recently that men produce the oxytocin when they are helping. So when they're changing diapers, when they do bath time, all of that. So we naturally produce it just from being around the baby more and more. For them, it's about service and doing that. And I thought that was beautiful to learn because actually men can produce as much oxytocin as a new mom. You just got to be involved in the mess,
Yeah, they're wired to provide and protect. And so when we engage them in that way and ask for them to help, they love to do that. They often need to be guided into what needs to be done, but that will engage them. And that also gives you that more time for your physical and emotional regeneration,
Yeah, I think so much of the self-care is about emotional and mental health. Some of it has to do with your physical health and being able to function and have everything working properly. But I think A lot of it has to do with the emotional health, and having a great partner and support system is so fundamental to that. So I think as you are pregnant, identifying those people in your life that can really be there for you in a wide range of ways. But let's maybe talk a little bit about recognizing postpartum and being able to see that in yourself, and then take steps to hopefully make it better.
Well, postpartum is it's a taboo word for a lot of people. They don't want to feel like they're depressed when they've been gifted this beautiful new life with a child. But it has a very big spectrum of how it can manifest. For some women, it's very, very severe, extreme depression, detachment, isolation, loneliness. And for some women, it's just feeling kind of blue, anxious, insomnia. So there's a lot of different ways it manifests, but you want to look for feeling apathetic, exhausted, not sleeping well, anxious, nightmares, fears, feeling of isolation and loneliness. And, there's different reasons why people experience this. We weren't really designed to have babies and then be raising them all by ourselves. We were really designed to be living in communities where women are raising children in groups. So in our modern society, a lot of women are really isolated. So it's very important to kind of get your tribe connected to you, even start to set this stuff up before the baby's born. Engage the family, the extended family, even the cousins, the siblings, the parents, to be there for you. You don't want to be alone. And if you are in a city where you don't have your family, to kind of make your friends part of your tribe. And that's really, really important. Even if you're not physically with people, to stay connected on a daily basis with people through phone calls and chats and things like that. So you have to have that physical, emotional connection to other people and feeling supported and somebody that you can really lean on. You want to be able to have an open dialogue with the partner about what you're going through, and just so that they can understand. And men kind of operate on the reward system. So when they know there's things that they can do to help you, that engages them, they give back, and then you feel more support. So it's a way of kind of connecting to them by engaging them to help and then honoring them for helping you. There's also the physical reasons of postpartum, the plummeting of the hormones, the depletion of the adrenals and the thyroid. And those are things like you can get low serotonin, low dopamine, low adrenaline, low GABA, low progesterone, high cortisol. Those will all make people feel the anxiety, the depression, the apathy, the fatigue. So, having like a healthcare person or a doctor to help you identify the whole situation around why you're feeling the way you are. Is it physical? Is it emotional? Is there something spiritually I haven't acknowledged? Just this huge archetype shift that I went through. So it's big, and it can be prevented, actually, if we kind of set ourselves up before. But you want to identify it early, not just kind of feel like I can plow through this, I'm going to be fine. Because you don't want to have that guilt of feeling I have this wonderful gift and I'm not having a good time. I'm actually not loving this.
Yeah, yeah. I think for me, the biggest blessing you've been to me was during my pregnancy, identifying that some of the hormones were off. And then, so my postpartum, I felt all the good stuff times 10. I was balanced going into giving birth. And then, so because of that, yes, I was very tired. Yes, I had a lot of just natural anxiety. I had the bad nightmares, the crazy nightmares. I do not miss those. But I was overwhelmed by this feeling of just love and joy and bliss with the babies. And so it's so important the work that you do because you're making motherhood easier in one regard. It's always going to be really hard, but if you can figure everything out physically and emotionally as best as you can, nothing's perfect, but if you can just do little things, if it's in your diet or, you know, you figure out how to get the lab work through your doctor, whatever it is, any little bit will help make it just a tiny bit easier. And when you're facing something as big as motherhood, that little bit can make all the difference.
It does, and women really need to know that. In my practice, at least, I would say at least 90% of women suffer post-birth with some kind of blue feeling, exhaustion, anxiety, sleep issues. So it's very, very common, and we don't really have to call it postpartum depression. I like to call it postpartum depletion. And so let's charge your batteries and fill up the gas tanks so that you can actually enjoy this road trip. And, you know, it's not going to be easy, but it can be easier.
I love that. And we talked a little bit about the importance of a great partner and a great support system. I love dads who are in the mix with the moms. I think as a mom, it's kind of like there's nothing better than that, right? You look at other dads in the service of their spouse or their partner or girlfriend or whoever is having the baby and breastfeeding, doing all these things. I'm a big believer that the partners need to feed the mothers so that the mothers can feed the babies. And so that relationship, it's very tricky, right? Because men are from Mars, women are from Venus, and we don't always speak the same language.
Not speak the same language, no.
Or even if it's not male and female, it's like people don't speak the same language, and you're put under this incredibly stressful situation, which is you have these living beings that are screaming all the time and won't sleep, and you're not sleeping, and it's, you know, so let's talk a little bit about, you know, just the difference. I guess we talked about the difference in men and women's wiring, right? That men operate on a reward system. And
well, you know, it's one thing to consider is that, especially if this is your first child, you know, in the relationship, the man was used to kind of being the baby, right? He was the center of your world. And, you know, the relationship was about you two. And now, you know, we come into this new phase, and the woman really is surging with those mothering hormones, and all she can really see is that child. She's wired for that. And it's very common for men to feel very lonely and isolated when a new baby comes. And, you know, I have men in my practice, I see the couple, and you know, before the birth, I'll talk to men and are they excited about this new baby? And a lot of them will be like, well, I just saw my friends and they all said, prepare to be invisible for 3 years. So it's tough on them, you know, and it doesn't, you know, we have to have this new way of kind of communicating with each other. Actually, men don't require a lot to be happy and to feel valued. And so what I usually start talking to my women patients with before the birth and in the new birth is that men operate on the reward system. Okay, so they do more when they're winning at something. So when the new baby, and they also are wired to provide and protect. Okay, they want to provide and protect. They want to give us things that give us value. And what's complicated is after the birth, the baby just really wants the mother because it's breastfeeding, you know. So the men get more engaged with the child naturally when the baby's usually about a year old. Okay, so the mother has to really kind of put a little extra attention into engaging her husband or her partner in a way by asking for help. And what I usually recommend is just say, this is what would really help me today, make my life so much easier. If you did this for me today, it would provide me this kind of value. And when he gives you that and he does these things for you, he's usually happy to do that, by the way. But when he gives you those things, you have to give him the reward of thanking him and expressing gratitude, a hug, a kiss, a pat on the back, and thank you so much. This provided this value. When they get that reward, they want to do more to kind of help some more. So it's kind of giving them what they need, but we have to identify what we want from them, put it in a very organized way, ask them if they would be able to do this for you today. This is what would provide this much value for me, time and energy. When they do it, show them the appreciation. Don't expect that they should do this automatically. They need to be valued as well.
It's really hard to manage everything that you're doing with new babies, and then you also feel like you're having to manage your partner or your spouse. But people are not mind readers, right? So even if you are, right. So,
and actually, men don't require that much. For example, if you're with your baby, you're breastfeeding, and he's sitting across, kind of looking a little gloomy, just blow a little kiss. Say, I love you. You walk past him in the kitchen, give him a little pat and a hug or something, because just let them know they're not invisible and that you value them still. It doesn't take a lot for us to do that. And it doesn't take a lot of energy to show them that they're still a very important part of your world. Because I just know, because I see the men too. They come to me all the time after the birth because they're feeling so lonely and they want attention. I'm like, I have to have a talk with Mrs. Johnson and tell her that, she needs to give a little bit of strokes and keep him engaged a little. Because, when you do, they help more. You get more out of them and their help and the love that they want to give if they know that they're still included, okay? And this is, hard. I hear a lot of women get almost angry that they have to even acknowledge these things. And it's, this is
because they're doing so much. They're doing so much already. And it's like, okay, now I have to cater to you on top of everything else I'm doing. But I will say from experience that even though it takes you an extra minute to explain to someone how to do something, you have to say, okay, honey, I need help with this. This is how you do it. Sometimes as moms, we look at it and we're thinking, well, it would be a lot easier and quicker if I just did it, right? Instead of having to explain it to someone else. But the long-term value of including people in how you're caring for the children, how you're caring for the home, it is worthwhile to take a minute and do it and appreciate the person who's helping you and love on them as much as you can, because, people aren't having sex after they've had the baby, right? So you're missing a piece of connection between the two of you that's physical. So to only have to give a little touch here and there and I love you or whatever, it's not a lot. And you would hope that they would do it for you, right? If the roles were reversed.
Yeah, you want to keep that physical contact, whether it's sitting next to each other and touching, whether it's a little pat, because you aren't having sex. Men really identify sex with love. And so they're not feeling that bonding. And the longer you go without physical contact, the more awkward it gets. So keeping those small little contacts, even if it's a few little pats a day, a little kiss, a thank you, I love you, I'm so happy we did this together. It keeps that physical contact so it gets less awkward when, it really does start to happen again.
And then for people who don't have a spouse, don't have a partner, and those are the people who really, while they're pregnant, need to be looking around and saying, okay, who's going to help me get through this? What's your advice to them? I mean, I'm sure you see single moms.
Yeah. I had an incredible patient who actually, she actually adopted two siblings, and she was single, but she engaged all of her friends to be the aunties. And they were a multicultural group of aunties, and each auntie had one day a month to come and help her with the kids. And these kids now are in their early teens, but they are such incredible humans. They've had this wonderful exposure to all these incredible women. And so, I think it's good to get some uncles too.
Wonderful.
And your other community, you know?
Yeah. Okay. What did we miss anything?
I think just one thing is to just think about that self-care thing. You know, like a lot of women, when they're a new mother, they feel guilty that they would do anything for themselves, whether it's yoga class, whether it's taking a 20-minute bath, whether it's getting dressed up and going on a little shopping spree.
I used to take a 5-minute walk to go get coffee. And my father came to visit, and he said, I'll set you up with a Keurig. I'll do whatever. You can just make coffee here. And I said, Dad, no. I said, no. That's my 5 minutes that I get to walk outside, have a breath of fresh air by myself, go get a coffee, feel like just a person again. So it was, it is so important. And people laughed at me, but I said, that's my time. I'm like, I need 5 minutes to go get a cup of coffee in the morning.
Exactly. And it's not an indulgence, it's not a luxury, it's a necessity. And the more you are there for yourself, the more other people can be there for you, and the more that you can be there for your children, your husband, your family, your partner. And so it just makes everything so much better. You deserve this. You're a mother. You're like the queen, and you deserve to kind of treat yourself in a beautiful way. It's not a luxury, it's a necessity. Enjoy it.
Yeah, I think too something that you just touched on in terms of asking for help. I know I have those friends, and I think I used to be a little bit more like this, where they really don't ask for help. And then I heard someone say something to the effect of, when you ask other people for help, it's like you're giving them a gift. You're saying, you're such a valuable person in my life that I feel like I can come to you and ask you to lend a hand to me. And it's sort of like that shift of asking for help. It's not a burden to other people. It's a loving way of telling people how important they are.
Of course, and all of us are givers, and we know how good it feels to give and to help somebody else. So it's that law of giving and receiving, right? When we give, we receive. When we receive, we give. So, people want to be there for you more than you know. And it's not a weakness to ask for help, especially with your partners and your families and your close friends. This is what humans are here for. If we were meant to be alone and do everything ourselves, we wouldn't be, living on this kind of planet. So we are designed to be with other people. And, when people do help us, when we honor them and thank them for that, and then we're going to give it back. We're like that. So,
Definitely.
yeah.
Well, I appreciate you talking to me so much. I can't thank you enough.
Oh, I can't thank you enough for all that you're doing, honey. You're just such a little gift in the world, and thank you for inviting me to be part of your adventure.
And I hope that everyone watching, just appreciates your gift of being here today, because you're very humble, but you are a very big time person who takes care of a lot of people and a lot of prominent people, and it's like your best kept secret. And to get an hour of your time to hear your thoughts and advice, it's so valuable. And I just thank you so much.
Thank you, honey. And good luck to all you beautiful women out there in your 4th trimester. You got this.
Yeah. I love you, Dr. G.
Love you.
All right. Bye. All right. So we'll cut there. Oh,
Love
you're the
you.
best.
Bye. That was awesome.
You feel like that went good?
Yeah, you're an incredible interviewer, honey. That was awesome.
Shaky at best.
A natural. You got to get your own you're an incredible interviewer.
So?
Honey.
I mean, it's hard. I was thinking about how hard it is.
Natural. You got to get your own show.
It's hard to interview people and be in the moment and converse, but also look at the notes and, you know, it's hard.
Great job. It was so natural, and you really brought your stories in such a great way. Great job. It was so natural, and you really brought your stories in such a great way. And I think that was one of the best interviews I've ever had. You did a fantastic job. You should consider that this was a new
hearing us talk
profession.
And then I'll do some more, and then maybe it could become something. I don't know. You know, I love talking about motherhood.
Yeah. I just am so proud of you, honey, everything you've done. I had to give you that little plug. That better be included on there. I just am so proud of you, honey, everything you've done. I had to give you that little plug. That better be included on there.
Okay. How are you doing? How are you feeling?
Don't dare cut my plug for you. It's been really stressful. Okay.
Yeah.
But I'm doing pretty good, hon.
Yeah.
It's been really stressful. You know, I have a really great assistant with me right now, and she's been, you know, I'm worried about her. I have a really great assistant with me right now, and she's been, you know, I'm worried about her, and just, you know, we've been doing all this shipping, and, you know, I'm a little bit, I'm not going to lie.
What are people doing?
Saddened by how some people treat her. You know, well, you would think that people